Hey everybody, Dr. Gord at National Spine Care and Sports Med. If you got persistent or recurrent low back pain, one thing you might want to consider is that your back might not actually be the problem. One thing we check for when you're in clinic or when you come to one of our spine boot camp classes is whether your back might be a victim of something else not moving properly. We look at what's called the joint by joint approach, which is popularized by Mike Boyle and Gray Cook. Which means your body alternates between areas that are supposed to be mobile and areas that are supposed to be stable. So one of the really common things we see is our hips are supposed to be mobile, but oftentimes they're too stiff, they're too stable. So in order to move, then your body has to gain mobility somewhere else, and typically that's in your lower back. That mobility that keeps transferring load into your low back builds over time through what's called a repetitive strain injury to keep recreating your back pain. So here's two easy tests you can do to see for yourself if your hips move the way they're supposed to. The first one is, or both of these tests, we get into what we call child's pose or lumbar locked position. This is just a posture where it locks your low back so it can't really move, and then we ask you to try and move at your hip to try and see if your hip moves without involving your back. So child's pose is just basically getting your butt down on your heels. Now I have a bit of a cartilage problem in my knee, so I have a hard time getting all the way down. So if that's the case, you're having those problems, you might use something like a rolled up towel or a pillow or this yoga block, and it just sits between your heel and your butt, so you can keep your butt locked down on your heel. As you bend forward, then all you do is you extend one leg out, and then while you keep your butt anchored down on your heel, you see if you can lift your leg up in the air. Okay? You're not allowed to take your butt off your heel or rotate through the waist. The second test is you get your leg out to the side so that your hip and knee are at 90 degrees. Same thing, you keep your butt locked down on your heel, and you see if you can lift your hip and leg up in the air. If you have a hard time getting down in that position, or if you have a hard time moving your leg and lifting it off the ground, that's a clue that your hips might not be moving as well as they should, and that can definitely be contributing to your back pain.